So good to see so many people here. Thank you for introducing yourselves on the chat. That's great. So welcome to today's webinar. It's being hosted by the Transforming Children's Care Global Collaborative Platform. As a lot of you will know, the platform is a community of actors and organisations that are engaged in child protection and care reform. The overall vision of the platform is to establish a more strategic sector-wide collaboration from the global to the local level by coming together and building on one another's work. So in order that we can secure a greater and more sustainable impact, as well as undertaking joint advocacy. The platform is open to everyone, and there's more information in the chat how to join if you've not already. As a member, there's lots to be involved with, as well as you'll receive updates, etc. So do encourage you to get onto the platform. Thank you. Could I have the next slide? Thank you. So today's webinar is going to be recorded and it will be available in Spanish and English. And the slides are also going to be made available and will be sent out to you after the webinar. I was going to say to you, please put your name and organisation and what you're doing and the country you're from in the chat, but I see that we're all quite familiar with that. So, but please, if you've not already, do introduce yourself. It's great to see who's here. You just need to select panelists and attendees so that everybody in the chat can see what you've put. That's great. Wonderful. Thank you so much, everyone. Throughout the webinar today, we'd encourage you to use the Q&A function on your Zoom panel at the bottom to ask any questions that you would like to any of the people presenting and our panelists. You can also vote for those questions so we can see which questions that lots of people would like answered. It'll help us to prioritize which questions we might answer in the discussion today. You can also comment on people's questions, so that's helpful too. So please do feel free to do that. We'll try and get through as many as we can. Perhaps the presenters will either type a response or we're going to bring some questions back to the panel later as well. My name's Louise. I work for the Martin James Foundation. So thank you very much for having me here. I'm really pleased to be part of this series of webinars that we're going to be holding. My current role is really gives me a great opportunity to work with teams in lots of different countries and hear about really incredible work that's being undertaken. And as we know, foster care, family-based care can look very different in the different countries and regions. I feel very grateful that every day I can learn something new from all the people that I work with. And I really hope these webinars will also provide the opportunity for us to hear about how things work across the globe, to share and learn from each other. Can I get the next slide, please? Thank you. So today is the first of 5 webinars that we're going to be undertaking, and they're going to look at different aspects of foster care practice. They'll take place once a month from now until August. You have the dates here on the slide. And throughout, we'll be hearing from people from many different contexts to talk to us about their learnings and their practice, as well as hearing from people with lived experience. One of the purposes of the webinars is to capture these learnings and experiences to inform a thematic brief paper on foster care. And after each webinar, we're going to be convening a task force group to have a more detailed conversation that's going to support the development of the brief. We talked before about the Q&A function, and if there's questions there that lots of people have voted on and some that we won't get through, what we're thinking to do is bring those questions to the task force group. The next one will convene next week, and I'll talk to you more about that later in the webinar. But would really encourage you to join the task force group if you're interested in foster care. Tell other people that you think would be important to hear their views at that group. And you can access it on the global platform. It's going to be really important for that group for us to hear from as many people and as many contexts as we can. So please do join. We're going to share some information later about how you can join the platform and the group. So that'd be great. Thank you. So today is the introduction to the webinar series. We're going to be looking at an overview of current global guidelines, which will be presented by Barbra Aber, who I'm going to introduce in just a moment. Barbra will then continue to talk to us about experiences in Uganda with particular reference to how foster care has played a part in overall care reform. We will then be joined by Lorenzo Foghill, who is the National Director for One Child, One Family, Hope and Homes for Children, South Africa. And she'll be talking to us about the particular foster care in the region. We'll then welcome Tammy-Jo Matthews, who is a foster carer in South Africa, who will share with us what it's been like for herself and her family. After these presentations, we'll have a panel discussion with each of the presenters, and we'll also be joined by Madame Rose Acha, who is a government representative from Uganda, and they will all discuss their experiences of the formalization of foster care. The purpose of these webinars is for us to share experiences and practice, but not to provide one model or one approach to care. As we know, there's so many factors and local knowledge that is needed to be considered in the development of any system in different contexts and cultures. And as well as this is the language we use to talk about foster care, which is going to vary greatly, including the term foster care itself. So with all the topics in the coming webinars, I just want to acknowledge that each presenter will be speaking from their own experience and context. So I will move on to introduce you to Barbra. Barbra Aber is the Regional Family Care Advisor at Catholic Relief Services based in Uganda. Barbra is co-convening the webinar series and the task force group on foster care. Barbra is a community development specialist, social worker, training facilitator, and child's rights advocate with 10 years experience. Bringing practice-based experience to policy-driven intentions in the social protection sector, Barbra has led and supported alternative care-related projects and care reform agendas in Uganda, Kenya, Rwanda, Tanzania, and Zanzibar. She's currently pursuing an MA in human rights, and Barbra also has a BA in social work and community development. And I'm going to pass you over to Barbra now. Thank you, Barbra.
Thank you, Louise. Good morning, good afternoon, and a very good evening to everyone joining us today. My task is twofold. One is to share some global standards and some learning from my perspective and from the context of Uganda and some other places on foster care. And I'd like to thank Hugh Salmon for some of the information that he shared with relation to the scoping study by Family from Every Child that also informed a lot of the information that I'm going to share with you today. So moving swiftly, when we talk about foster care, there really isn't specific guidance speaking on foster care on its own, but rather a lot of the guidance we see is integrated into broader documents that speak to foster care, that speaks to alternative care in general. And the first of those documents, as we may all know, is the UN Convention on the Rights of the Child, that really articulates the importance of understanding and meeting universal child rights and specific needs of individual children. So it looks at it from the rights perspective. So this is really just telling us that even children in foster care, you know, all the rights as articulated in the UNCRC apply to children in any care arrangement, including foster care. But it also speaks largely around the best interest of the child being paramount and decision-making processes. And then more specifically, we see guidelines for the alternative care for children. And again, with this, we see general guidance for alternative care, but there is within this document a specific section that defines what foster care is. And we'll highlight in the next slide. But it also provides a brief section on how foster care needs to be set up. So you'll see that a lot of that is around systems, around how it needs to, sorry, previous slide, please. So the UN General Guidelines on Alternative Care does speak generally, but also provides some provisions of how foster care needs to be set up. But then we also have the moving forward document that then tries to break down what those guidelines speak about in general for alternative care in terms of what implementation really looks like. And even within that, you find that there is very specific guidance of examples of foster care, how it needs to look, how it looks like in some contexts, etc. We also have the interagency tracking progress tool that has a specific theme that addresses itself to formal family-based care. So questions around what state parties are doing around setting up formal family-based care systems. You know, with the impact of COVID-19, we've seen some specific guidance coming up as well around COVID-19 and how we manage that in the context of alternative care. And within those documents, there's always also a section on considerations for foster care. So you see a trend that whereas we don't have a specific provision standalone document on foster care, we do find that foster care is interwoven into every discussion around alternative care as being part and parcel of family and community-based alternatives to residential care. So what then is foster care, right? So the UN guidelines for alternative care articulates that the foster care is situations whereby children are placed by competent authorities for the purpose of alternative care in the domestic environment of a family other than the child's own family. You know, but it also highlights that, you know, the people that care for children should be selected, qualified, and approved to provide this care arrangement. But, you know, it should really be noted that the definition of foster care, like Louise highlighted before, as provided by in the guidelines, by no means really provides universal, the universal definition of foster care as used around the world. We're seeing that this varies in very many contexts, and comparisons of these different definitions has been somewhat difficult. And the definitions and perceptions of what kinship care and what foster care is in some places is very gray. There are some contexts where you find that they use the term kinship foster care, for example, in areas where they refer to placements, formal placements of separated children with their kin that's supported and supervised. They then refer to it as kinship foster care. But these, as provided for in the UN guidelines, are actually two different care arrangements. And we do have a whole working group specifically assigned to the conversations around kinship care and trying to unpack what that is and the potential linkages, if any, to the conversations around foster care. So if you do want to hear more about kinship care, about how that relates into bigger care reform and how it relates to foster care to some extent also, there will be a webinar series that speak to that. But just to highlight that we do acknowledge that there are contexts, for example, in Liberia, in Thailand, in India, and potentially in Indonesia, where we see that, and some parts of Asia, where we see that there are some conversations where these two are used interchangeably, and there's a thin line between those differences. So just something to keep in mind. So it's also become, you know, foster care in general has become the primary form of alternative care in most parts of Europe, in North America, in parts of South Africa. But we see that these are really just this is really just emerging in Asia and Africa, where a lot of the countries in these continents are, you know, implementing it on small scale. They're using it as pilots for learning, with the hope that once there's a better understanding and we're grounded in the practice, it can then be scaled up. Next slide, please. So in terms of some of the key principles and provisions as highlighted in the UNCRC and the UN guidelines, you know, you'll see that a lot of the principles are very similar to some of the things that we've been talking about generally as practitioners in this field. So, you know, things to do with the best interest of the child being paramount in all the decisions. And this relates to foster care because even in those conversations around where to place a child, you know, those decisions around suitability and necessity the principle of best interest still does apply. And then meaningful child participation, not only in the decision-making as highlighted, but also in the assessment and review of their placement options in the foster care arrangement. So recently, in some of the work we were doing in Uganda, some of the children did highlight that, we were not consulted. We did not know, for example, that we were going to be placed with so-and-so, and we don't know how long we're here, etc. So it really highlighted, and these were views from the children, and it really very much highlighted the need for active and meaningful child participation in some of these discussions. And then the right to identity and knowledge of birth groups and birth origins is really, really key. Many times in some contexts, you find that children are placed and then the conversations around transition, around where you're from, around contact with birth family isn't actively discussed. But we're learning that in the UNCRC, in the guidelines for alternative care, some of these things are stressed that, identity is key, knowledge of birth origins is key, and this really largely does apply also to the context of foster care. And then the right to grow up in a family, very much rights-based approach. So even when children are placed in foster care, it's still their right to be returned to birth families, but also it's a right to grow in that setting where it is family-like, it is in a family environment that helps them meet their, that meets their overall well-being and growth potential. And then there's the aspect of assessing, planning, and deciding care plans in partnership with family members. So in the event that family members are how do you then work with them to facilitate safe and effective transitions? How do we facilitate meaningful and safe interaction between children in foster care and their families of origin, with key relatives, with friends, etc.? How do we do that? And then, of course, the key thing is the permanency planning that I mentioned. With foster care, it's very key that conversations around permanency planning or transition are interwoven into the discussion from the very beginning, because foster care is an alternative care arrangement that isn't seen as a permanent arrangement. It is seen as a step to a more permanent care arrangement. Next slide, please. So other things to consider as highlighted from the moving forward document is the importance of integrating the formal and informal discussions of care provision. Like I said, in many contexts, we have sections where there's informal foster care, for example, and then there are others where there's formal foster care. So really, how do we recognize the strengths and weaknesses of both? How do we coordinate these different forms in a coherent way? But I think most importantly, how do we clearly designate a person or entity who's responsible for the child at all levels? Is it the principal? Is it the parent? Is it who's the principal caregiver? Is it the foster parent? How do you prevent conflict? But there has to be a designated person who has the responsibility for that child in that care arrangement. And then the moving forward document also speaks about ensuring multi-agency cooperation and information sharing, because this comes from the feeling that this placement option, like many others, will draw from different stakeholders in the provision of the needs of both the child and their caregiver, to ensure the overall best interest of this child and deciding what appropriate care option is needed. So acknowledging that many people need to be involved at multiple levels. And then developing and implementing alternative care policies based on evidence. Like Louise said, there isn't the thinking that it is a one-size-fits-all arrangement for foster care, but rather, what does your context say in terms of the data that you have? What care arrangement would suit the needs of the children in that particular context? That then informs the design of suitable family-based alternative care options. Even within foster care, as we will see, there are very many variations of foster care. So whatever decision you make in terms of which care arrangement you do decide to set up should really be based on sound information and statistical data. Next slide, please. So, and then, a key thing to note as well is that, just as we highlighted in the initial documents, that foster care is really incorporated in the conversations around alternative care in general, foster care cannot be implemented in isolation. You can't say that we're going to implement foster care on its own, but rather it has to be part of broader alternative care options. What are the options that exist? What are the needs of the children in that particular context? What care arrangements do we need to set up to address that? And foster care might very well be one of them, but it isn't a service that's implemented in isolation, but alongside key elements of prevention and integration, priority being how do we first and foremost prevent separation from happening? And then how do we ensure that in the event that separation does happen, how do we then work towards safely returning these children back into their families of origin? And then this is where, of course, the conversations around necessity and suitability comes in decision-making. Is this care arrangement appropriate for this child? Is this care arrangement needed for this child? And it informs decision-making in terms of placement options. And that also really is a good segue, in the understanding that foster care needs to then be embedded into broader care reform and a continuum of care. So in the next slide, please. So as outlined in the UNCRC, for example, caring for a child in their own family is what is needed, is what is supposed to be prioritized. So if you look at so this is an example of a continuum of care within the Ugandan context as part of the alternative care framework. And you'll see that, the family-based care options in Black, they're prioritizing family care as a first option, kinship care, and then foster care, and then potentially guardianship as well within the Ugandan context. And that really does highlight family-based care options. So you'll see that foster care isn't on its own, it's not the first, but rather as part of that continuum of care that needs to be followed. And then really just highlighting that effective foster care needs to be part of a broader overall national alternative care strategy. Next slide, please. So like I mentioned, not really implemented in isolation, but the family, community, and alternative care services make up the entire system of of coordination, of changing a country's way of responding to the needs of separated children within the balance of effective decision-making processes that determine necessity and suitability, but also with strong monitoring and support systems that really prioritize effective four-way partnership between the children, the caregivers, the birth families, and the authorities, and support for reintegration and living care. Next slide, please. So, what are some of the key principles of strong foster care? And I think, it being child-centered is really the first, and that it should be part of a broader child welfare system. Many times you find, just even within Uganda, there's conversations around alternative care are siloed. You'll find segments of the government speaking about alternative care, other segments of the government and civil society speaking about child protection, for example, and child well-being. But then we're saying that's when you're implementing alternative care in general, and when you're setting up foster care, it needs to be incorporated into those broader conversations around overall child welfare and child well-being. Another thing to highlight is that foster care it's cost effective. It's really cheaper compared to residential care, but it's not cheap on its own. It's not something that you say that we can do away with residential care because it's going to cost us it's going to be cheaper to set up foster care tomorrow, for example. It really is a process that requires transition from a certain care system to a more family-based one that takes time, but not entirely cheaper. because you need to initially set up systems, you need to train the workforce, you need to identify potential caregivers, you need to set up systems for monitoring and decision making that might not necessarily be cheap at the onset, but longer term will be cheaper and better for children in general. And then foster carers must also always receive training, support, and information, because that's kind of the bedrock in which they then better provide support to the children that need that. And then there are different models that need to be piloted, need to be tested and adopted. Like Lou said, we're not in this webinar presenting a situation where we're saying this is the current model that needs to be adopted, but providing the various options, various perspectives, and saying pick what you feel applies best to your context, pilot, test it, adapt it, and then scale as appropriate. But within that, consider the social, the culture, and the geographical factors, aspects of religion, or local traditions, of rural and urban differences when it comes to, for example, recruitment, motivation and willingness of foster carers, acceptability of foster care in general within that context, the strength of the support networks that the caregivers will receive, etc., are things that we need to keep in mind. And then, in terms of what the governments need to do to support some of these building blocks, it starts at the national level. It really starts with setting up appropriate legislation and regulations that oversee the implementation. And then at subnational level, equipping the workforce to effectively implement, support, and deliver safe and effective foster care. And by this we're meaning providing safe and transparent accreditation to foster care agencies where they apply, because not every country has foster care agencies, but has organizations that may be implementing foster care. So, is the government aware of that? Have they signed an MOU? If they're agencies, is there a safe and transparent accreditation for them to operate and to implement foster care? And then the issue of safeguarding, also very key. Are we ensuring that the children in foster care are provided with the safest environment for them to grow? How is this being implemented? How is this being monitored? How are we vetting? How are we providing training to ensure that safeguarding and protection concerns are adhered to? And then the issue of recruitment and training that I've spoken about, it really takes a competent workforce to support, to set up and run effective foster care as a family-based alternative care option. And then the government has to have the ability to effectively and realistically recruit foster carers within different contexts as needed, and it takes time, and it takes a certain level of commitment. It takes a certain level of resources to do that. So there needs to be that commitment to actively identify potential foster caregivers that can support the setup of foster care. And then the capacity to train these caregivers once they've been identified, and then supporting them through the process of approval, and then longer term through the rotation of receiving and letting go of children and providing that rotational care as needed as many children come into the system. And then, lastly, the issue also related to the child safeguarding is the issue of criminal record checks and obtaining balanced in-depth references for foster caregivers, that assessment process, that vetting process. Are we identifying the right people? Are they providing the right type of care that we need? What kind of support are we giving them? What kind of training are we providing to them to effectively provide that? And then really just as I summarize, safe and transparent systems for assessment and approval of foster carers is really key. We have to have an objective system for decision making. It's really important that assessment of children's needs, matching and care planning is implemented in the right way. But we need to monitor placements in foster care through regular visits, seeing and listening to the child, hearing what they have to say about these placements, but also working with the birth families, as I highlighted, very key when it comes to transition, when it comes to permanency planning, and ensuring that the linkage is made, and that once that time comes, it's not something that was an afterthought, but planned from the very beginning. And then also acknowledging that placement breakdowns do happen, do occur. How then do you manage that? If, for social workers, we know that there's nothing that goes 100%. So knowing that there are instances where these placement breakdowns will happen, there needs to be a process of managing those breakdowns when they do happen. It's not if, they happen, but it's when they happen. How can we then set in place systems to manage that? And then complaints procedures for children and foster caregivers. Not every, and birth families, it's not a situation where, like I said, everything will go smoothly, but how do we listen to all parties concerned when these things are not going well? How do we address the complaints? How do we improve? How do we have a policy that has a mechanism for managing complaints, for managing protection violations as they come? How are we really implementing some of those key elements? So, lastly, I wanted to just quickly touch on financing and budgeting. I've mentioned this already. Foster care usually costs much less than residential care, but we still need safe and high quality foster care. It still requires a high initial investment. And also, when countries are going through process of transition, we have to be aware that you're not going to realize any savings in the first 2 or 3 years. This is a long-term investment. This is a long-term plan. So you might be able to see some of those reduction in costs in the 3rd or 4th year even. So just really something to highlight. And once foster care is established at a sufficient scale as part of a continuum of alternative care services, then savings for repurposing or closing of institutions can then be reinvested. So that's why we say it's not implemented in isolation, but it's as you're really redefining what the care for children in that context is, through either repurposing, through setting up these other family-based care options, reintegrating children to kin, etc. So that full cycle of support. And then there's need to balance investment in foster care with prevention. So if the buzzword at the moment, if everyone's talking about foster care, we're not saying talk about foster care and forget the elements of prevention, of kinship care, of family reintegration, as highlighted in the continuum of care highlighted. Foster care comes at a certain stage. So all of these other pieces need to be set in place as well to ensure that this is part of that bigger system, part of that bigger plan to support children in all contexts and provide longer term investments for changing the way we care for children in general. Thank you so much. Over to you, Louise.
Thank you, Barbara. That's great. Always good to hear from you. I'm now going to welcome Lorenzo Foghill. Lorenza is the National Director for One Child, One Family, Hope and Homes for Children, South Africa. She leads a team working to catalyse care reform in South Africa. Positioned as the knowledge partner, they're working in partnership with the Gauteng Department of Social Development to deinstitutionalise the child protection system in the province as a demonstration project for national reform. They're also working in 5 other provinces of South Africa to create enabling conditions for change. So thank you, Lorenza. I'll hand over to you now. Thank you.
Thank you, Louise. And good morning, good afternoon, and good evening to everybody on this webinar. It's really great to have this opportunity to share with you some of the learnings that we have from our work in care reform in South Africa. So for us, a really key element of care reform has to be prevention, which is responsive, efficient, and provides both the early identification and quick intervention functions, but also then the alternative family-based care options. And in South Africa, we have legalized, formalized foster care in terms of the Children's Act, which is long-term or what foster care, formal foster care, which can be long-term. We have temporary safety parents, which is a short-term placement within communities, usually for 90 days. And we have recently piloted specialist foster care, which is focused on supporting families with children with disability. Can I go to the next slide, please? Right. In terms of our journey in care reform, the elements of political will, appropriate legislation, policy, and budgets is key in effecting care reform. But sustainability of that lies absolutely in the prevention and effective early intervention model, but also making sure that your forms of alternative family-based care options are working properly and are serving the purposes as an element on the continuum of care for 90% of children. And for those children for whom reunification will not be possible, that it does offer permanency and with a focus to developing into domestic adoption. We focus very much on ongoing service delivery implementation partnerships between government, civil society, communities, and corporates. It's really important that foster care and care reform is not a single dimension or single department focus. It has to be all of government, and it should include communities with intentional child participation to ensure that the best interest of the child principle is really given meaning and effect. Another key element for us, of course, is the monitoring and evaluation system. So tracking of the child in family from first point of contact with the child protection system, and very importantly, being able to measure and evaluate the outcomes for children and families. Both children reunified with biological families, but also in terms of foster care placements. Really important for us is the ongoing support for children and for foster carers or temporary safety parents, and as well as ongoing training and intensive monitoring of outcomes for those placements. Can I move to the next slide, please? Right, so our model that we've developed together with government, the AFS Kusela Community Prevention Model, has yielded really excellent results. And it's really important for us to emphasize that we are, during the COVID pandemic, we realized that disaster situations like the state of national disaster that was declared can paralyze government access and support services to families who need the most, families and children in communities. And from there, we developed the AFS Kusela Community Prevention Model. And really, it's taking the existing family-based care options and placing management and actual support of those functions back into the heart of communities through training and enabling community-based organizations, key actors in communities, so that would be specialist NGOs and ordinary community members, to provide that monitoring and support and linkage for children at risk and families, children who've been placed into alternative family-based care options, but also then to work under the supervision of the statutory social worker. And just by that simple shift in management of these functions, we're seeing far better outcomes in terms of fewer breakdowns, in terms of greater efficiency in reunification of children who've been placed into temporary safety parent care. And at all times, the contact with the birth family or the biological family or the carers of the child remains in place, which really does have a much more positive outcome in terms of eventual reunification and stability of the child in that placement. The model is both relational. It builds on the strengths of families and communities, which we think is really important. And it kind of removes sole reliance on governments and will always be there, enabling continuity even at times of crisis. And it is systemic with clear role allocation, clear tools, assessment tools, family service plan tools, and yielding solid data in terms of outcomes for children and families. Could I move to the next slide, please? So in terms of the assessments, we do assess across 9 well-being domains for the child and family. And then from that, we can develop an efficient targeted family service plan, which then provides the baseline, which is measured for outcomes on reassessment and allows for course correction. I think this is a key step in making sure that case management and actually development and rehabilitation, both of the birth family and also of the child in the temporary safety care placement or the foster care placement, does proceed optimally and that we do reach positive outcomes. So in terms of mechanics, we create alternative family-based care option banks in communities. And these would include screened, trained temporary safety parent families, which are there for emergency placement and usually for a maximum period of 90 days, while work is done to enable reunification. Specialist foster care, which we utilize in terms of stabilization of children who are on a treatment program, while at the same time resourcing and educating the parents or the carers of the child to better be able to manage those conditions. And in so doing, we prevent family separation or permanent family separation. And the advantage of this is that the specialist foster carer builds a bond with both the child, the professional service provider, and the family, and is always there as a support mechanism within the community, enabling, for example, respite care for parents with children who require more intensive support. We also then look at, for the very small number of children who cannot be reunified and for whom placement in extended family is not possible, at formal foster care, but on the long-term basis. So focusing on a 2-year placement, which is reviewed, and then during that 2 years to prepare and initiate the process for domestic adoption. And we've just recently concluded 3 domestic adoptions based on that principle, which I think is quite groundbreaking in terms of the generally poor uptake of domestic adoption in this country. However, I think the secret to it is really in the training, in the screening, and the ongoing support for both the foster carer with the intention of to adopt, as well as for the child who's been placed into that placement. The AFS Kusela model, in addition, plays a key role in safeguarding, and it enables kind of early identification and quick and effective intervention through linkage to the appropriate service providers, thereby mitigating escalation and harm of safeguarding incidents. Really, the networks that are created perform a kind of a surveillance function in communities who are best placed to then identify where potential risks lie, and also are able to support placements, both from children who've been transitioned out of institutions back into families, but very importantly, children who have been placed into temporary safety parent care or into foster care placements. It's been really effective, and so far we're really showing promising results in terms of the outcomes for both the children and the birth families. And I think the question that is very rarely asked is to the foster carers themselves. What was the experience like for you? Is it needs to be a learning, but a fulfilling experience. And I think so important that we don't lose sight of really making sure that we acknowledge the foster carer, the temporary safety parent, as a key actor within the continuum of care. Could I move to the next slide, please? This is really a graphic kind of depiction of the community-based model. And ultimately, always, we try to reach family reunification. And we found that, you know, foster care in South Africa, I mean, we've got almost 500,000 children in foster care, formal foster care in the country. But it's so important that contact with the birth family, biological family, or extended family should be allowed while that child is in that placement, so that it kind of reinforces and positively creates momentum for reunification. And it's not a matter of, or the bonds between the child and the birth family are not strained or ruined effectively, which very much can complicate if it's at reunification. And it all along this continuum of care, children need to be participating in these decisions. So we form kind of a team, which is the temporary safety parent, the foster carer, the child, the social worker, and the birth family. Communities, also another really important point, is the services that we can leverage within communities, the support that comes from communities who are aware of the need to look after vulnerable populations. And it's often more effective than depending on governments solely. So we see communities as an active actor and element of sustainable alternative family-based care option placements. Could we move to the next slide, please? So really the model and our work in terms of prevention and provision or support of the alternative family-based care options is aimed at giving agency back to communities and families, enabling them to better manage the challenges in their own ecosystems and leveraging the strengths that exist in communities as a support to government agencies, NGOs, and enabling linkage to specialist services within communities to support those families. And especially, we have so many organizations with such good practice that really there is no gap. It's just about linking and coordinating those services around the support of those families. A key thing, of course, is governments should redirect budgets away from institutions to support prevention and to properly support alternative family-based care options, such as, foster care, temporary safety parent care. And the one element that is really underlies the efficiency of that redirection of budgets is being able to track and to measure outcomes for children and families, and then to utilize that data to see which communities, for example, are the greater feeder communities, what are the characteristics of those communities, and how best can one prevent, or what services rather should be offered in those communities to support those families. Next slide, please. I think this for us, the budget speech in February 2022, where our Minister of Finance, Minister Enoch Godongwana, announced that in the allocation to the Department of Social Development, the implementation of the extended child support grant, which would allow double orphans to grow up in the care of extended family and not be placed into foster care. Again, we want to emphasize that alternative family-based care options are absolutely necessary as a prevention and a support mechanism in communities. However, it should not be seen as kind of the answer to all problems. It should be seen as an element of care along that continuum of care, and have a specific function in terms of allowing work to be done with the families to enable proper reunification, sustainable reunification, and especially, for example, with children with difficult behaviors or who are on specific treatment regimes, that the families, the birth families are equipped, resourced, and educated and enabled to better manage that condition while the child is stabilized within that placement, and the linkages are made between, the service providers and the family and the child. So it's really a win in terms of care reform that we are now enabling and recognizing that most of the children who are double orphans, there is always an extended family member, but they need that support. And so to enable to implement the extended child support grant enables those extended family members then to take on additionally children who would otherwise have ended up long-term in foster care, for example, and in worst case scenario in institutions. Thank you. That is my contribution for today, and I look forward to any questions.
Thank you. Thank you so much, Lorenza. It's so interesting to hear about the work that's being done. I'm now going to introduce you to Tammy-Jo Matthews. Tammy has been a foster carer for the past 9 months. She's worked with young people for over 10 years, focusing on creative arts and drama. Tammy's passion is in developing youth in dance and drama and using this skill to impact their lives through positive words, affirmation, and self-confidence. Tammy also runs a feeding scheme for the community and is an accredited commissioner of oaths. And I'm going to hand over to you now, Tammy. Thank you very much.
Hi, thank you, Louise. Good morning, good afternoon, good evening to everyone. So I'll be sharing my experience on being a foster care parent. So like you heard, I've been in community development for the last 10 years, and it's been quite a journey. So I've always had children in my home, youth sleepovers, camps. This has been part of who I was, but a foster care mom was not something I would have imagined doing, but this also stepped in front of me. And was I willing to do this? In my mind, I could not imagine doing it, but in my heart, I knew that this was what I needed to do. So for the last 9 months, I've been a foster care mom, and the journey's been, it's been hard, it's been tough, but it has also been fulfilling. So after being a foster care mom for the 9 months and also being introduced to the training with Open Homes, One Child, One Family, I do understand and also believe in the importance of foster care. I cannot imagine what would have happened to these 3 young girls after losing their mom. So at the time, in your mind, you have all of these logical things happening, but in your heart, you know that this is what you need to do. And my husband and I stepped up and we took these girls into our home. Bringing them in with they've got different upbringing, different genealogy, a different environment. It was challenging, and also I have my own two kids and needed to have them work together and also understand one another. One another was quite a hefty task. So having my own children, to accept that our little family has now become this immediate huge family, was quite an adjustment. Our family needed an immediate change in heart because we needed to care for these children as if they were our own. And I do believe that that is an important point when taking children into your home and having children, your own children, not making the foster children feel that they don't belong, but opening up your home and opening up your heart, but making them feel as if they are your own children, because you wouldn't want them to come out of a traumatic situation and then come into a home where they are also feeling maybe not loved or that they don't belong. So that is very important, that children should be treated with love, respect, and kindness when welcoming them into your home. And many times I needed to sit down with my own kids, having to explain to them what we need to be for these children, what kind of love we need to show to them, explaining to them the role that our family is playing to this new family that has been brought into our lives. And so, like I said, the journey started out tough. Everything increased. We needed to make adjustments in our home because we needed to they needed to be comfortable, they needed to be safe, the sleeping environment needed to be comfortable. The driving increased, groceries went from skyrocketed, the water bills, everything went up because you've now increased in everything. And that is where I felt that the support was very important in raising now not only 2 children, but 5. And the support that I've received, I am overwhelmed by the support, but I could never have done this without support. And the support that I have received, my grandmother also stays with us, and she's got such a huge heart, and she just welcomed these girls in with so much love. And as a parent, and many of you are parents, working parents, so I do have a full-time job. So coming home, having to cook meals, sorting out the washing, doing all of these things, that can become a burden. But with my grandmother by my side and as a support, those things were ticked off. So the kids had home cooked, nutritious meals from an older person and not a young mother who would have probably been serving takeaways. They received their nice warm cooked meals, and this is the kind of support that helped me a lot. And then also I spoke to one of our network partners. She's also a principal at my son's creche, and I spoke to them about the girls and about the need, the educational need. And I asked them if how she could assist, because the elder sister was not currently in school and she needed to be homeschooled. And she offered their support. I could bring the kids in for free. I didn't need to pay for them. So all 3 of them are currently at the same homeschool, educare. They have aftercare classes there, and this was given to me for free. So I do believe that support is of utmost importance, because it's definitely not something that you can take on alone, something you can take on your own. So that is very important. And the people have been so good, like they would donate financial contributions because they knew that the weight became more as the cost became increased, everything increased. And this lady would support them. She would see that they had their toiletries. She would give financial contribution towards their clothes and towards their toiletries. And that really overwhelmed me by the love and support I was receiving from others and even my own family, the way they've supported and belonging to the organization that I work for. It's been an amazing journey of receiving that support and being there not only for them but all the children in our community. So when it came to government support, I felt a bit let down. I do feel that the social workers probably have too many cases or too much work. Their load is too heavy because after the children were placed with me, I've not received support as I requested, where I felt that the girls needed emotional support and counseling, and that was not provided for. Where financial support needed to come in, it was delayed, and there was always an issue, and there was always problems presenting why it could not be paid or why not on time. And I feel for other parents, temporary safety parents or foster care parents that maybe does not have the kind of support that I've had, um, I feel for them because it's a hectic task, and if you don't have the support, you do feel frustrated at times, and it could get overwhelming. So I would hope that government would, redirect all their resources maybe into this, in support, in training, in supporting the children, because I believe it's an ongoing journey. And while the girls have been with me, I have not kept them away from the biological father, because he actually stepped up, and he was willing and is willing to take his girls back. And we've been visiting. First, it would just be 1 hour visits because I was also still a bit skeptical. And then afterwards, it would be a day. And then recently, they've had a weekend sleepover. So the relationship building is happening. And we are in a process of reunification. He's also put up a new place, and he's extended his home with an extra room for the girls, and we've been assisting him through this process. So reunification is important, and it's also been something that I needed to process, because while the girls have been there, we have grown so close, and I just felt that I would never want them to go back. But I also needed to understand the importance of reunification and family preservation. So the journey for myself and for the biological parent we've been growing and we've been learning, but it is still a process, and the support has been, with the support, I believe that this is why the process is becoming a success story, because with the father, we've been supporting him all along, and at the same time, I've been receiving support. So um, it's definitely going to be a sad day for me if they're going to be reunified with their father, but also just to see the joy in the eyes of these children when they speak about him, and when they've spent a weekend and tell me about it, to see the joy in their eyes, and also the excitement from the father's side. I think that brings joy to my heart, and just knowing that I could have been a vessel at the time, and just being willing and open, and to open up our family, to open up our home, to open up our hearts to these girls, has been a great experience. And I believe that if we do have more people who are willing to do this, while the kids are in a safe space and while they're in a safe environment and the families being worked with, I do believe that there will be more reunification and family preservation stories coming out. So that's my journey and my experience, and I would like to thank you all for listening. Thank you, Louise.
Thank you so much, Tammy. That was brilliant. I hope you're reading some of the messages on the chat. I'm going to hand over to Barbara now, who's going to lead us with a bit more discussion from our panelists.
Thank you, Louise. Just a second, I think I'm having a bit of a challenge with technology. But yeah, now, thank you so much, Lorenza and Tammy-Jo. Now I would like us to shift a bit to some panel members, to Lorenza, Tammy-Jo, and Madame Rose Acha, who will answer some brief questions around formalization. Rose Acha, like we mentioned at the beginning, is a government social worker who has been working in this sector for over 12 years. Her role involves influencing policies and legislation that promote and protect children's rights, coordination and supervision of government facilities like remand homes, like reception centers for separated children, and the National Rehabilitation Center for Children in conflict with the law, as well as the supervision and capacity building of her district social workers in the areas of child protection, of alternative care, and juvenile justice, among others. Very, very welcome, Rose. And if you could kick us off with answering a few questions. Why did Uganda choose to formalize foster care when many contexts have informal foster care already integrated into the community? Share with us the Uganda perspective, please.
Thank you so much, Barbara, and thank you everyone who is on the webinar. I don't know if my video is seen. I'm not seeing myself, but I want to greet everyone in the webinar, and I'm sharing our experience from the Ugandan perspective, why we formalized foster care. Okay. So for us, is my video now seen? Okay.
Yes.
For
yes.
Yeah. Yes, we can. Thanks, Lee.
Yes, for us as Uganda, one of the reasons why we formalized foster care is to safeguard the rights of children. We realized that for us in Uganda, the foster care actually involves filling a lot of forms, about 4 forms, for a foster parent to be approved as a foster parent. So in that process, that helps us to be able to track this foster parent and also to monitor the bonding between the foster parent and the child in case the fostering is for adoption. We've placed children in foster care under different circumstances. We have emergency foster care, where especially for the abandoned children. And this is done as we continue tracing for the family and relatives of the child. And then also we place children in short-term foster care, some of them in long-term foster care, but also fostering to adopt, either domestic adoption or intercountry adoption. So in all these processes, the law requires that the foster parent, the foster carer, is given a foster care order from court to formalize the foster care or the placement of the child into their family. So in formalizing foster care for us, it helps us to observe the principles of necessity and suitability. Of course, we only place a child in foster care when we feel it's absolutely necessary and we have done all our efforts to trace for the next of kin or relatives of the child, and we have not found. But also, as we place this child with a foster parent, we look at the most suitable foster parent who can meet the needs of this child. Because as we know, children have different needs at different stages and ages. So we try our best to match the child with a parent who can meet their basic needs. And of course, when we placed the child with the parent, it helps us to link this family to any available service, which can be the government services or services provided by NGOs, because then we shall be having records of this family in our offices. The monitoring of the foster parents is done by, we have probation and social welfare officers at the district level. And these are the people that you can call them an equivalent of social workers. The law mandates them to monitor the foster care placements, such that in case of any violation of the rights of the child in the process of foster care, then another suitable option or another suitable foster carer can be found and the child removed from the abusive environment and taken into the conducive environment. Thank you very much. I think that is all I had for that question, Barbara.
Thank you so much, Rose. And you've highlighted important aspects. So around issues around making the right decisions for the child, making those decisions around necessity and appropriateness of each placement, and support to these caregivers. And also that assessment process and monitoring for risk and safety. So very, very important aspects. So I want to switch a bit to Lorenza now. You did share quite a bit about what was happening in South Africa and the project that you're doing. So how does this look, the formalization, how does this look in terms of implementation from a service perspective, from your angle as a practitioner?
I think that for us, because we are working closely with government, and really our task is to support them in service design and tweaking problems that, or the gaps that we have identified in the existing, for example, forms of alternative family-based care. We are able to start piloting on a small scale, to bring that evidence and really very closely monitor for outcomes, well-being, resilience, and risk in terms of children and the families. And also there's a cost component involved in that as well. So we take that data, we present, the piloted data on a small group of children to the provincial government. And from there, they are able to scale that up. So I think that in terms of scalability, we have seen certainly that our approach with the AFS Kusela model, which is contextualized, it's actually worked, we developed this together with government based on the existing legislation and services that are available in communities. It is very much scalable. And we have a very strong social support system in South Africa where grants are paid. So for example, we have a foster care grant, we have a child support grant, and we have temporary safety parent grants that are paid. So the financial or the existing budgets for that is already in place. It's about looking at how do we maximize and how do we optimize the utility thereof and the outcomes of that to achieve optimal outcomes for the children and and their families. One of the problems in South Africa, of course, is lapsed foster care grants. And I think, again, this was touched on by Tammy in terms of, government social workers being overburdened. But I think if we if we shift the emphasis back to communities and we start really proactively working together in partnerships, so communities, foster carers, children, and then the statutory, or the professionals, it does create, it makes it easier for those professionals to actually process the statutory parts, because they have the information, they have the reach, government has the data, and in so doing, scalability, is much more possible and has been demonstrated to work. I think that there's a long way to go still. I think that, this is recent for us, but the outcomes so far have been really encouraging, even under the worst conditions, and especially during COVID. And I think it kind of brings together what we have, a central tenet of, care reform for us, which is it's not only government, it's not only the NGO sector, it's the whole, all the stakeholders, communities, families. We need to build together to make sure that, optimal outcomes are reached across all the elements of in the continuum of care.
Thank you so much, Lorenza. And then switching a bit to Tammy. I know you shared a lot of your experience already, but just from the angle of formalization and some of the steps that Lorenza has referenced, how is this process of formalization working for you as a foster care, as a foster caregiver?
Hi, I didn't get that quite clear. You've been breaking up. Can you just repeat?
I thought we'd lost Barbara, but I think she's back. Are you back with us, Barbara?
Is she back?
Yes.
Oh, I didn't get the question quite clear, Barbara. Because you
Sorry,
were breaking up. Yeah.
Yes, I am struggling with internet today. My apologies. So just really continuing in that space of that discussion of formalization, I just wanted to get your perspective as a foster caregiver, how this process of formalization is working for you and your family.
The process of formalizing it, the process went quite efficiently. The social workers came out and checked out the home and formalized the process quickly, because I think they just needed to get the case done, and they needed to get the children safe. My concern, however, is that with coming out and coming to check out our place, it was done so quickly. There's many things that could have been overlooked. So I do feel that these type of things needs to be done properly, because you don't want to place children from one traumatic home or situation into another bad home or situation. So that should just be done more efficiently. And however, in South Africa, the process goes quite swiftly.
Wonderful. Thank you so much. And you do raise an important point that even though some countries have gone the formalized route, it doesn't necessarily translate into people implementing it in the way that it's written in the guidelines and policies, right? They just came in and out, and you thought they could have done a better job, which really hints to perhaps some of the gaps in some of these processes that I need to continue improving these processes. So thank you so much for that perspective. And I think to everyone, this is, because we've discussed formalization isn't to say this is the route that every country goes through, but rather to highlight that this is what some other countries have gone through. And hopefully, in the next couple of webinars, we can also hear from the perspective of practitioners and actors in countries that haven't formalized, what has that been like? What are the pros and cons of that? What's working and what's not? Stay tuned for more conversations around this. Thank you so much. And back to you, Louise.
Thank you, Barbara. Thank you so much. Thank you so much to all of the people that have talked to us. It's been so interesting. We've had so many questions through, and I think it just goes to show how much the discussion that there is to have, and how good there is that we have more webinars and a task force group happening next week. So we just to again talk to you about the task force, some of the questions that we've had there, sorry that they haven't all been answered here. We're going to bring those questions to the task force for further discussion. So we have a task force group next Tuesday, and where we're going to have a more detailed discussion again, and just again you join the platform and join the foster care group. Would really encourage people with lived experience to attend, as well as foster carers, government representatives and practitioners. So please do share the information as widely as possible. If there's someone you think would be interested in joining, or someone that we really should be hearing from, please do come on the platform and request to join, and it'll put you in direct contact with myself, Barbara, and the rest of the members of the group. So really look forward to seeing you there. Just a final reminder that the recording is going to be available in Spanish and English, and the slides, and they will be shared in the next few days. You'll get an email with them on. And just also to say a big thank you to Catherine and Margot from BCN for all their hard work in bringing together today's webinar. And also thank you to Nora and Rosalia and Anna for interpreting today. I think thank you definitely to all of our speakers there. It's been really interesting. I hope people have really enjoyed hearing that, and are looking forward to hearing some more over the coming series. So thank you everyone for participating, for your questions, and being here and ready to talk about foster care and the experience of people in different contexts. Thank you so much, and enjoy the rest of your day, and hope to see you next time.